Um, if there's anyone still around, I just wanted to do some questions because we've gotten a bunch of questions in prior live streams and I just haven't had time to do them. Um, or maybe I just haven't been doing it properly. But so I'm going to go through some of them. And if anyone's still around, you can ask a question. If there was anything unclear about what I said about remdesivir, let me know and I'll say something else about that. But for now, let's see. I'm going to go through some of the older questions that we had. So any changes with Omicron with the preventive ivermectin? Is it still recommended twice weekly? Yes, I would say continue. Yeah, twice weekly for prevention would be good. Should we stop since Omicron is milder and then take ivermectin treatment protocol if a COVID infection? So I think this depends on if you're very high risk. And nowadays, after talking to Gert Vandenbosch this morning or earlier this afternoon, I would say that the people who have been vaccinated are highest risk and might want to, and especially if they're older, they might want to consider being on the twice weekly ivermectin and then having all the medications on hand just in case they catch the infection anyway. To treat it on day one or day two. And if you have never been vaccinated and you have natural immunity, then it's much less, of a concern, and I probably wouldn't take. I have natural immunity. I don't take ivermectin twice a week, but I would keep medications on hand in case you get sick again, just because each illness with each new illness with COVID does set you up for possibility of long COVID. If you already had long COVID, it can bring it back, and it's just not worth it. Do you have any recommendations post COVID? I smell fish frequently throughout the day. Is this a long COVID symptom? So changes or parosmia, changes, strange smells or changes to your sense of smell is a long COVID symptom. And I generally approach almost all long COVID the same way. I try ivermectin, then steroids, then fluvoxamine, then XYZ. But actually, I start off with over-the-counter supplements first, and and then move along to medications. But you can get the free ebook at mygotodoc.com for the over-the-counter supplements that I use for long COVID. And but if you just had to choose one thing for parosmia or for changes in the way that the smell is working, that might be fluvoxamine. Oftentimes fluvoxamine helps. I would hesitate to use that as a first line for any long COVID though, even if it's the most likely to help, just because it's an SSRI and it has some side effects, and you may need to be on it for a few months and it can change the way your brain works. So it's one thing if you have to treat COVID and you have to take the SSRI for 2 weeks. That's not really going to cause any problems with your brain function. Your brain's not going to get used to it. But if you're on it for a few months, which oftentimes you have to be for long COVID, that's when I start to get worried about using an SSRI. So I put it a little bit lower down on my list of things to try. So, any suggestions to treat chronic fatigue syndrome due to COVID? I'm a nurse and a long hauler for 1 year and still can't exercise and get fatigued easily. So, I mean, this is one of the most common symptoms of long COVID or long haul is chronic fatigue. And if it's just long haul COVID that's causing the chronic fatigue, then you approach it the same way as any other long COVID. You start with the supplements, and then you take ivermectin. Try that. If that doesn't work, you add steroids. If that doesn't work, you add fluvoxamine. If that doesn't work, you go down the list. Um, we also nowadays for long COVID are using low dose naltrexone, finding that to be very helpful. Fish oil. In terms of the over the counter stuff, you've got vitamin C, vitamin D, quercetin, zinc. It's really important with quercetin to also have bromelain, and I'm actually working on a supplement. It's going to be at mygotostack.com. You'll be able to buy it because there are some supplements out there that have been formulated for long COVID, but there's none that have the bromelain in them. And without the bromelain, you don't absorb quercetin barely at all. I mean, it's barely absorbed. So you really need bromelain to get the quercetin into your body. And then I've also put vitamin K2 in this supplement that I'm developing, which is really important when you're taking high doses of vitamin D because it prevents. So vitamin D helps you absorb calcium, and K2 prevents the calcium from being deposited in your arteries. Instead, it goes to where it needs to go, which is into your bones. So curcumin or turmeric is really important. Also working on an herbal supplement that has curcumin. Black seed oil is really important. We're going to put that in there as well. But for now you can get them anywhere. So curcumin, black seed oil, and the doses are available at the flccc.net. You can look up their long COVID I Recover protocol, and then. Um, and then the prescription drugs. But I would start off with the over the counter supplements. Give those a couple of weeks and see if you start to feel better. Avoid exercise that's beyond zone 2 heart rate. You don't want to elevate your heart rate. You don't want to do cardio exercise. You want to stick to in the beginning, I would just not do any exercise, and then once you're aware of how your body responds, you can try really low impact exercise, maybe weights or something that doesn't get your heart rate up. But the main approach is to try to avoid things that worsen your symptoms with long COVID. And I do have a long COVID video that I put out. That's the first video on this channel that you can take a look at. But also take a look at the free ebook at mygotodoc.com. There's a long COVID section. And flccc.net, the I Recover protocol. What is the actual name of the test to assess free circulating spike protein? So I think it's the S1 subunit test, basically S1 subunit, and they test for that. I've only actually seen one person do it from IncellDX. You can go to covidlonghaulers.com, and I haven't tried doing this myself, but they do test people for S1 subunit of the spike protein in monocytes. So they have, I think there were 3 or 4 different lineages of monocytes. This was the test result that I saw. They showed whether or not those specific types of monocytes had the S1 subunit of the spike protein in them. What about quercetin? So quercetin is important for acute COVID. It's important for prevention. It's important for long COVID. Quercetin helps you to get zinc into your cells. Zinc has an antiviral effect, and like I said before, quercetin doesn't really get absorbed without bromelain. So you got to take bromelain as well. What are your thoughts on the snake venom news? So I have a separate video that I published about the snake venom, and I'm trying to get Dr. Artis on to talk to him directly about that as well. So hopefully we'll have him. I'm pregnant with long COVID. There's no information about what's available for pregnant women. What do you recommend? So with pregnancy, you got to be careful because things like turmeric or curcumin and black seed oil may have effects during pregnancy that you don't want. Stimulate labor and stuff like that. So from what I remember, turmeric does have some effects like that, so you want to be careful with those. You can use vitamin D, vitamin C, zinc, and quercetin, as far as I know. Double check on the quercetin, but I think that is okay. And bromelain, I think, should be okay. But you need to screen these things with your OBGYN because some things, especially at higher doses, do have stimulative effects on the uterus and can send you into an early labor. So that's the main thing you want to be careful with. Depending on how bad it is, try some of the simple vitamins and supplements, as long as your OBGYN is okay with them. I would wait to treat it with, prescription drugs until after you're done. I would try to avoid ivermectin in pregnancy. I would try to avoid steroids in pregnancy. Fluvoxamine, I would definitely avoid in pregnancy. The omega-3 fatty acids should be okay. But again, double check on the high dose ones. And what else? Low dose naltrexone. I don't think that should be an issue, but I don't know specifically for pregnancy. So if you were my patient, I would check, what each of these things, the effects they have on pregnancy. And in general, I would probably just wait until after the pregnancy. And again, it depends on how severe it is. If it's like severe depression that's like life threatening, that's different than if it's mild fatigue, and you can put up with it for 9 months. So it really depends on the woman and on the baby and on the pregnancy. So it's really specific, what the recommendation would be in pregnancy for long COVID. Have you seen anyone with long haulers have only nighttime low oxygen? I don't think I've seen anyone who only has low oxygen at night. One thing to be aware of is that the pulse oximeters that you have at home are not super accurate. So, you may not actually have low oxygen. It's a possibility. But it sounds like if it's only at night, then it's probably it's probably real. But maybe there's decreased blood flow to your fingers at night, and that's probably where you're checking on the finger. And it might not be super accurate at night. So I would take it with a grain of salt and get some confirmation. Maybe do a sleep study, because they would be able to check that during a proper sleep study. But it is certainly I don't know why it would only be at night, but it's possible that that would happen with long haul syndrome. I just can't think of why physiologically it would only happen at night. Um, if it was like real, like actually blood oxygen was actually low and it wasn't just an artifact of low blood flow to the extremities. What do you think of the Italian study of urine and blood samples that have snake venom? Oh, and also stool samples. Yeah, I'm not aware of this study. I think that you have to be clear the terminology that you're using, whether it's full on snake venom or whether it's something that's found in snake venom. And so most of the studies that were cited by Dr. Artis in the interviews, they're talking about things that are found in snake venom, not literally snake venom itself. So, but I'm not aware of those specific studies. Dr. Pierre Corey has a great Substack article on a lot, if not most, of the studies that were cited and some of the issues with them. Um, have you heard about the report that links COVID and remdesivir to king cobra venom? Sounds far-fetched, but it makes sense, especially since they now banned monoclonal antibodies antivenom. Yeah, so I gave my 2 cents on this. In a short video. I think it was like 15-minute video, and probably there's two other sources that I'd recommend looking at. Dr. Pierre Corey's Substack, he has a great article about the venom theory, and Dr. Mubin Syed has a good video on it as well, and they both focus on different aspects of it. I've experienced long haul chest pain that is so far not diagnosed by my cardiologist other than atypical chest pain. Flared up after COVID reinfection. Anybody know more about what causes this? So, yeah, so chest pain is one of those symptoms that happen with long haul COVID. And, um, any chest pain can be a number of different things. It can be the heart, it can be the lining of the heart, like a myocarditis, it can be muscular, it can be inflammation of the cartilages or the bones. It can be in your in the linings of your lungs, maybe not in the lungs themselves. And it can be vascular. You can have a vascular issue like a spasm, coronary artery spasm. It can be esophageal. Your esophagus can have a spasm, or it can have inflammation in your esophagus causing chest pain. So there's so many different things that can cause it can be neurological. It can be a pinched nerve. It can be, it can be an inflamed nerve. um, it could be something in your skin. So there's a lot of different structures in your chest, and it's not always where you feel the pain. That's where the pain is. Structurally, it could be somewhere else, and you have referred pain. So if there's a pinched nerve in your back, sometimes you'll feel it in the front of your chest. So that's number one. There can be a lot of different things, like being causing the chest pain itself at a structural level. If it is due to long COVID basically affects people through inflammation. So there's inflammation, and it's due to this S1 subunit of the spike protein, which is in your atypical monocytes. These immune cells hold on to the S1 subunit of the spike protein, and they create inflammation. The inflammation causes the symptoms. So um, that it the root cause, if it's long COVID, is long COVID inflammation. And so the solution is to help your body get rid of that inflammation, which also helps your immune system kind of reset and get rid of the spike protein. And then once the spike protein is gone, the inflammation is no more. So whether or not the chest pain is due to long COVID is another story. The Incel DX testing can help you determine that. If you go to covidlonghaulers.com and request the IncelKind panel, that if that shows the typical COVID, long COVID inflammation, and especially if you have the S1 subunit and a spike protein found in your body, then it's more likely that that's what's causing the symptoms in your chest. What about muscle twitching nonstop? That's actually, yeah, that happens with long COVID. Worried about permanent nerve damage. So again, this could be a lot of different things, right? It could be peripheral nerves, it could be central nervous system issues, it could be, more at the level of the muscle itself. And again, if this is due to an injection injury or due to long COVID, you need to treat long COVID the way you treat any long COVID is treated the same way. It's basically use the medications to help get rid of the inflammation, which helps your body get rid of the spike protein, which hopefully gets rid of the symptoms. So I wouldn't worry. Try to treat it, and I wouldn't be worried about permanent nerve damage at this point. How can I get rid of brain fog that I've had for over a year, and fatigue? So this is really typical symptoms of long COVID: brain fog, fatigue. These are like the number one and number two symptoms. Fatigue number one, brain fog probably number two. And so there's a number of different approaches to long COVID, like I've spoken about already in this uh, particular live stream. You can use supplements, over the counter things, and then medications. And one thing that I haven't spoken about yet in this live stream is fasting. So there's a fasting protocol that you can also use. Generally, it's recommended to wait on using the supplements. If you're going to try the fasting protocol, do that first. Before you try the supplements. So it really depends on what you're willing to do, what you're willing to give up, and if you don't want to try the fasting, I forget the name of anyway, if you register at the website or send us a message at mygotodoc.com, we'll get back to you with the name of the fasting protocol. It's available online. And then we also have the free ebook at mygotodoc.com, where you can get the supplements, and again, you can see them at flccc.net. The iRecover protocol is basically the same supplements. And then the next step would be trying medications for it as well. And then, just one thing that I'll say is that if you try everything and nothing works, um, you know, there are a couple of things that have been reported for long COVID that I haven't actually used yet, but I've heard great things about. So that would be mesenchymal stem cell infusion. Apparently, just one infusion, and Steve Kirsch has this up on his Substack. He's spoken to a rheumatologist who has experience with this, and soon, it should be published as well. But he's said that helps a lot with acute and long COVID, and it helps within a week. So that's a more expensive option. But if nothing else works, then I would consider that. And then the other thing that I just spoke to Jim Thorpe about, he's an OBGYN, is using ozone. So you can actually get ozonated olive oil and ozonated coconut oil and stuff like that you can put on topically. I don't have a lot of experience with it, but he says to start slow and gradually increase the dose. You can also get ozone therapy, through the IV, and a bunch of different ways to get ozone therapy. But the simplest seems to be topically. So that's another option. Apparently, high dose vitamin C also increases apparently ozone. I think I just learned that. Um, but with vitamin C, it's difficult to absorb a lot. You can try liposomal vitamin C, but there's a limit to how much you can absorb of vitamin C unless you get IV vitamin C. Um, let's see. Is pulmonary fibrosis being reported in large percentages of long COVID patients? Um, so I haven't seen reports of this, but this is something that I'm really worried about, actually. Especially this is something that you would see in people who had severe pneumonitis or pulmonary inflammation during the acute infection. I am worried that some people may end up with this if they have long haul, inflammation going on in their lungs and it's not being addressed. But this is not something that's super common. But the people who have severe lung damage after an acute infection, they probably have pulmonary fibrosis. And one of the things that I've the only thing I've heard that may help. I mean, there may be other experimental approaches, but one thing that I've heard of is inhaled heparin. So heparin is usually it's a used for blood clotting, and it's used for heart attacks, and it's basically a clot buster, and it's used for deep vein thrombosis and things like that. Um, but and it's not usually given inhaled, so it's rarely used. It's used more commonly in Europe, apparently, for pulmonary fibrosis and the inhaled form. Um, but it would be easy to mix up if you gave the pharmacy the directions. You could find a compounding pharmacy if somebody prescribed inhaled heparin for pulmonary fibrosis. I think it's worth a shot because there's really no treatment available for pulmonary fibrosis. So, I mean, at that point, if you try everything else and it's not getting better, um, I don't see any downside to trying inhaled heparin, and it's been reported to be effective in some trials in Europe. Um, let's see. Is there a test that can tell you how much spike protein you have? Yes. And this was answered earlier. It's the S1, at least it's the S1 subunit of the spike protein is what we find people holding on to in their bodies in the monocytes. And the only company I know of that'll test for it is IncellDX. You can go to covidlonghaulers.com to get access to that test. Have you seen a lot of patients who are experiencing internal vibrations and buzzing sensations? Yes. This is, I mean, it's not the most common symptom, but it's something that I've never heard of before long COVID, and with long COVID, I hear it all the time. So it's a common long COVID symptom, not super common long COVID symptom, but it's a symptom that was basically unheard of until long COVID came along, and there's a significant subset of long COVID patients who have this symptom. Um, and yeah, I'm not sure what the etiology is. The treatment is the same as long COVID, any long COVID treatment. Stepwise treatment. Start with the supplements or fasting, one or the other. If the fasting doesn't work, add the supplements. Add the medications for long COVID that are commonly used in the iRecover protocol. If that's not working, then the last step is Maraviroc and or ozone therapy and or mesenchymal stem cell transfusions. um, and I would, yeah, I mean, what's causing it? I don't know. I mean, it seems like it might be something neurological. Have you seen vaccine injured fully recovered? So, I mean, in my practice, people get better to 80 to 95% better, and then they don't follow up. So I think a lot of doctors have this experience that we don't really know if people are fully recovering or if they just got 95% better, and then they were just like, I just don't feel like bothering with it anymore. Um, so that's been my experience that people. I can't think of a specific person who was specifically vaccine injured who came back to me and told me that they were 100% recovered. I can think of long COVID people who told me that they were 100% recovered. Um, will MCAS symptoms go away after treatment? Yeah, so MCAS symptoms I think are treatable and they can go away. So again, whether it's 100% gone or not, that's a different story. So I think that if you're persistent enough, then I don't think that it's permanent a permanent injury. It can be. You can get rid of it, but sometimes that last few percentage points of improvement can take a really long time to get to. So you can get to 90%, 95% relatively quickly, within a couple of months, and then the last few percentage points of improvement can take longer or require more ingenuity. It might be a little bit harder to eke out those final gains. What options are available to low-income patients that are natural for those of us with long-haul symptoms that cannot afford these medications? Fasting, absolutely the cheapest thing you can think of. So I would try. It's Tom Bunker's fasting protocol. So you can look it up. It's online. TOM is the first name. BUNKERS Bunkers or Bunker, and then apostrophe S. Tom Bunker's fasting protocol. If you Google it, you'll come upon his website. I would try that. Fasting actually cures a lot of diseases. Maybe every disease. So I would start with that, and then just a clean diet. When you are eating, eat an anti-inflammatory diet. So look up the paleo autoimmune protocol. In terms of diet, that would be a good place to start. Eat really clean, avoid pesticides, and don't eat meat, eggs, if they're not organic, grass-fed, meat, and pasture raised, chickens. So if you can't afford really clean food, then avoid that specific kind of food. So if you can't get clean meat that's organic, raised on grass, and pasture raised chickens, and and that applies to the eggs, the meat, the milk, cheese. So if you can't get really clean versions of those foods, which are expensive, then just don't eat those foods. And I know that they're healthy foods; they're great foods, but you have to avoid pesticides and things like that when you have inflammation going on in your body. You don't want to add anything that causes inflammation when you're already inflamed. So you got to eat really clean and fast. And then if you have anything left over, um, you can try juicing, fresh vegetables. That's a great way to get, vitamins into your body, and and a lot of other compounds that are very health promoting, if you can't afford, vitamins and supplements. So those are some options. Get and do things like, learn some qigong or some, tai chi or something. These stress relieving exercises, you can learn them for free online. You can look up YouTube videos. Get some sunlight every day. Have good relationships with other people. Spend time in nature. Go for a walk. So there's a lot of things you can do. You can just a lot of functional medicine things that you can do without spending any money. And I think, oftentimes you can, people spend a lot of money just because they have it, and they, um, don't want to change their lifestyle. They'd rather take a pill. But the people who get healthiest are actually oftentimes the people who spend the least amount of money. They just drastically change their lifestyle. So, you can find all this information online, how to change your lifestyle. And, from a functional medicine perspective, you want to change a lot of different things. Fix your relationships if you have bad relationships with people. Fix your relationship with God. Fix your relationship with yourself. Fix your relationship with other people. Um, and smile every day and be happy and make other people smile. Um, I got COVID Christmas 2021. I took your protocol and recovered, experiencing telogen effluvium. Any experience? Um, no, let me just look it up. It sounds familiar, but, um, oh yeah, temporary hair loss, a form of temporary hair loss. So a lot of people are reporting, hair loss with long COVID, and hair loss, it takes a while to, for your hair to recover. It can take months. Once you're actually 100% recovered, it can still there's still this lag, period uh, where you'll feel like your hair hasn't gotten better, but because it takes, a few months for the, once your hair falls out, it takes a few months to recover it. So, um, there's a definite lag. And, other than treating long COVID, or checking to see if you have long COVID still, if you still have that inflammation. So if you have no other symptoms except for thinning of the hair, then you might want to check to see if you have inflammation from long COVID. And if you have the spike protein in your body, then you would treat it, right? And until that inflammation is gone, until the test showed normal and the spike protein's gone, and then you would give it a few months and see if your hair recovers. At the same time, I would also check things, vitamin levels and things like your thyroid, thyroid hormone levels that can be affected by, that can affect hair. So there are a couple of things that, maybe talk to a functional medicine doctor, things that can affect your hair, aside from long COVID. Have you seen anyone who gets a short fuse mentality after COVID, possibly from brain inflammation? So, I don't know that I've specifically had anyone. No, maybe a couple of people have told me this. And and if you can get depressed, and have anxiety, those things can cause, some people to to snap easier and get upset and angry easier. Just having, this extra anxiety that you're carrying around itself can cause somebody to develop a short fuse. Um, so it may be a secondary manifestation of something else. The stress of COVID, and um, so I don't know that it's like a primary manifestation of long COVID. Are there any alternatives to aspirin? I can't take it since it triggers my ulcerative colitis. So so you got Plavix. Plavix may work if aspirin does not. And then like in Cell DX, Dr. Patterson recommends for vascular inflammation, specifically statin drugs, low dose statins. So something like Pravastatin, 10 milligrams daily. I would take coenzyme Q10, 200 milligrams daily with it, and it's the weakest statin out there. So it has the weakest effect on your blood lipids. I'm not a big fan of statins, but it does have an anti-inflammatory effect in your vasculature. Um, and then I mean, if aspirin doesn't work, I mean, because it triggers ulcerative colitis. Yeah. You may have to avoid. There's yeah. So I mean, if Plavix is one option, and then there's Eliquis is another option. So there's other blood thinners, and then you just have things that are kind of have an anti-inflammatory effect in the vasculature, like statins. And you may not have to use aspirin at all. I mean, you can start with using everything else, right? And see, you may not actually need aspirin. It's not necessarily the case that every single person needs to use aspirin. Is COVID toes? Have I seen many of those? Yes, I've seen a lot of COVID toes. I had them myself. It's a very very common thing. Um, and Yeah, so this is a vascular problem, right? They're painful, like blue spots, discolored toes, tender, and this is vascular inflammation and possibly micro or even macroscopic clotting is the issue here. So aspirin, maybe Plavix, maybe Eliquis. So blood thinners and anti-inflammatories like the statin, ivermectin. Really, the general treatment for long COVID is basically it's non-specific. It covers all your bases, and they tend to get better, but it can take a really long time for them to clear up. But I what it would worry me is not just the toes, right? If that's happening in your toes, it's probably happening all over your body, and a lot of other organs. Or in your it may be happening in your organs, it may be happening in other places that you can't see. That's what you're able to see, but it may be happening in other places as well. Any patients who have had interstitial cystitis? Um, so I think maybe one patient came to me complaining of interstitial cystitis. I mean, it's a common issue with men and women, but mostly women anyway. And it's sometimes it's difficult to determine if it's truly interstitial cystitis or if it's just a chronic infection that is difficult to diagnose. So there are some chronic infections like ureaplasma that are difficult for labs to diagnose. They don't show up on the typical urine cultures. So there are some advanced labs that run let's see that run um, DNA-based testing on urine samples. And so I've written a little bit on my blog at mygotodoc.com. There's a section, there's like, I think 3 articles on UTIs. And I think the Why Do I Keep Getting UTIs article has links to some of the websites that will help you diagnose whether it's actually a chronic infection. And so if it's not a chronic infection, then it's interstitial cystitis is basically an autoimmune disease, and I would treat um, long COVID that's manifesting as interstitial cystitis like I do other forms of long COVID first. um, and then if that doesn't work, then at the same time I would probably go ahead and get the look try to figure out if it is a chronic infection. And let me just see the chat here. Does vitamin D level have any effect on long haulers? Yes. So vitamin D it's one of the important treatments for um, prevention, for treatment, and for long haul as well. So you need to get your vitamin D levels up to at least 30 nanograms per ml, and after that, there's a range of normal, and just because you're in the normal range doesn't mean you're at the optimal level for yourself. So Chris Kresser has a great blog article on this. There's a relationship between vitamin D, calcium, and parathyroid hormones. So basically, you need to have normal range vitamin D, normal calcium, and a parathyroid hormone that's less than 30. So the parathyroid hormone should be suppressed to less than 30. If all those things are the case, then your vitamin D level is probably at a healthy level. Um, so you could have a low parathyroid and a normal calcium, and you could raise your vitamin D even more, and that probably wouldn't be beneficial. So once you get all those things in the right area, you don't need to go up anymore. Kalonji seeds, yeah. So I think that is black seed, and that's also really important for long haul and for treatment and for prevention. Let's see. Super Alien says, I've tried fluvoxamine for 3 days. The side effects were just unbearable with bad and unwanted thoughts. What do you recommend? Fluoxetine or Prozac is oftentimes has much fewer side effects than fluvoxamine. So I would consider trying low dose Prozac, maybe 10 milligrams, then 20 milligrams, then 30 milligrams if you can tolerate it. Um, if that doesn't work, I mean, it depends on what you're trying to treat, right? So this isn't medical advice because I really don't know your background. But generally, if I think fluvoxamine will help somebody and that doesn't work for them, we try fluoxetine or Prozac. And if that doesn't work, sometimes I try Elavil, which is amitriptyline. Um, and if none of those work, then we'll try some other route, try something else. Should we take NAC if we feel well? I would take it for long COVID, and for treatment of COVID. I wouldn't necessarily take NAC for prevention, to prevent, like, daily, to try to prevent COVID. Vax injured. Oh, okay. So Super Alien is vax injured, first dose, 6 months post. The best supplements for brain fog. So I like curcumin, and black seed oil. I mean, really, it's hard to predict which supplements will work for specific symptoms in specific people. So people who are treating themselves for vaccine injuries and long COVID need to experiment on themselves, and it's helpful to have a doctor along with you, but um, oftentimes you can get, most of it done yourself, and the other thing, maybe low dose naltrexone, that's not a supplement. So fasting is oftentimes really helpful, and then and and I would consider also, the omega-3 supplements. High dose omega-3 would be helpful too, probably. So the live stream top three amigos, the live stream top, I add them as soon as I have it scheduled. So there should be a whole bunch of live streams scheduled right now. I'm trying to do most of them Monday and Thursday at 5 p.m. Eastern time. Today, Gert Vandenbosch was earlier, but he was scheduled for a few days. I think he was kind of a last minute thing, but I think a couple of days in advance I scheduled him. But most of the live streams should be, there is a bunch of them already scheduled for this month, and they're already up in the schedule. I'm not sure where you find that on YouTube. Um, but there is a way, I think, you can subscribe to a channel and also um, sign up for like alerts, I think, for when somebody live streams. I'm not a YouTube expert. Whitley Richmond, have had facial muscle twitching and itching on the toe. Doctors are recommending high dose methylfolate because I have MTHFR mutation. Apparently helps diabetic neuropathy, so thought it might help. Yeah, so activated folate or methylfolate may be helpful with people with MTHFR. Um, just because you have the mutation doesn't mean you have a functional problem with methylation, and so you want to do some functional tests like homocysteine. And if homocysteine is above 7, then you need extra B vitamins. Um, and so methylation is a complicated topic. I mean, it's something to really talk about with a functional medicine specialist who really focuses on those things and does them a lot with a lot of people. But the facial muscle twitching and twitching in the toe, I mean, if you haven't checked B12, I mean, that's an easy thing. It's usually normal, but it should be above 500, and it's not always above 500. So B12 functional range is 500 or above. Um, and so it certainly doesn't hurt to try adding B vitamins and activated B vitamins if you have the MTHFR mutation. Have you read Dr. Kerry Mullis, who said in 1996 about the PCR test that he created? What do you think of the efficiency? Yeah, PCR tests. I mean, yes. I mean, I'm aware that you shouldn't use them for. I mean, the PCR tests are a very, very poor way of, they were misused during the pandemic, for sure. I mean, I agree with what he said, and I agree with most of what's been said and written, criticizing PCR tests and the way that they were used in the pandemic. Um, yeah, it's a big topic, and it's, what should they have done? That's another question. Um, looking back on this pandemic, I mean, nowadays, I don't care what somebody's PCR test shows. I don't care if it shows negative or positive. If there's a lot of COVID in the community and somebody has COVID-like symptoms, I just treat them as COVID. That's basically what I'm doing, and how I'm treating people, because I think that's the only thing that makes sense for most people, because it's not harmful to give them these medications, but they could end up being very harmed if they develop long COVID. What's your opinion of aspirin? So I like using aspirin in most people who have either vaccine injuries or long COVID, if they're able to tolerate it. And I'll usually actually tell people to start it first before starting other medications, because for some people, it seems to help clear up microclots. And then if you don't start the aspirin before you start the other things, sometimes people have side effects, from the other medications when they haven't started with aspirin first. Hyperbaric oxygen, I've heard a few people recommend it and who have tried it, so I don't think it would hurt to try it. I haven't heard a lot of people telling me that it's made a significant difference for them, though. Um, can shed vaccine spikes from vaccinated persons get into my system, produce the same results without actually being vaccinated? I I don't know. I think it is a concern. It was listed in the Pfizer documents, as a possibility that, people could shed the spike protein, and so I do believe it's possible, either through sweat or could be inhaled, exhaled out on your breath. And so I think it's a possibility. And people tell me that, a lot of patients tell me that they have symptoms when they travel or when they're around people who are vaccinated. Their period changes, they start bleeding, or, something changes, and they can tell they have change in their health when they're around people who are vaccinated. And that, what could they be shedding? Either it's the spike protein or it's lipid nanoparticles. Basically, those are the things that could be shed. And I think the things that would cause the symptoms that people describe would be that, spike protein. And but everyone that I spoke to who has these reactions, they're short-lived. So they don't. It's not like it makes you into somebody who's been vaccinated. So I wouldn't worry that you have become vaccinated secondarily from being exposed to somebody who was vaccinated. I think it's something that can cause like an allergic reaction in people, and they'll have symptoms, but it doesn't stick around. Your body gets rid of it. What are your thoughts on the use of Maraviroc? So Maraviroc, if you look it up, it's got what looks like a terrible safety profile. And I would say that that I've done a little bit of research on this, and in people with HIV who are on Maraviroc for years and years, they have heart attacks. They may develop cancers. There's some serious issues with it. I've now used it in hundreds of people, who've gone through Incel DX, and no one has had any serious issues. And obviously these patients don't have HIV, and they're only using it for 1 to 3 months, and then they stop. So maybe maximum 4 months. So I think that, but all that being said, still there's a possibility, right? So some people who've been vaccinated, for example, might have a vaccine injury. They may have vaccine-acquired immunodeficiency syndrome, very similar to AIDS. And Maraviroc in those people may have the same side effects as it does in patients with HIV/AIDS. Um, and even in people who don't have vaccine-acquired immunodeficiency syndrome, a short course of Maraviroc may cause problems 3 to 5 years down the road that we don't know of, right? So it's the last thing that I would try. I mean, I would try things that are safer yet more expensive. I mean, Maraviroc can be quite expensive, but if you can afford it, if you try everything else, nothing else works. Go and try like mesenchymal stem cell transfusion. You can actually get it in the U.S. I mean, it's not that you don't have to go to Mexico for these mesenchymal stem cell transfusions. I mean, it might be a few $1,000, but one 30-minute transfusion, it doesn't have downsides, right? It doesn't have risks the way Maraviroc does. And then and also the like I was saying earlier, ozone therapy. Um, no risk, and certainly try everything else before you get to Maraviroc, and that's my approach. Unless somebody comes to me and they're like, "Doc, I just want to use Maraviroc. I heard it works great, and it does work great." So the people who use it, it's one of the most effective medications for long COVID. And what we hope is that people, we're correcting something with Maraviroc, right? So it's a CCR5 inhibitor, and we're using it to lower the levels, that we see elevated in the body, right? And so hopefully, it doesn't have those negative effects because we're not giving it to somebody who has a normal, level of CCL5. We're giving it to somebody who has elevated levels, and Maraviroc is decreasing the levels. Whereas if you gave it to somebody who had normal levels and you were further inhibiting those levels, maybe that's one of the reasons that it causes significant side effects in some HIV patients. But at the end of the day, we don't have the data, right? So we don't know how safe it is in the long run with people with COVID. We think that it's safe. We hope that it's safe, and some people are willing to try it because they haven't been able to get better with anything else. And in the short term, it's proven to be very safe, right? So like 1 or 2 out of 300, 400 people, maybe 500 at this point, people I've seen come back with like weird labs, and we stopped their Mavroc. Um, one patient out of hundreds, complained to me of some, I forget what it was, like change in their mentation and like anxiety or something. But like it's very rare. I mean, the vast majority of people, more than 99 out of 100. So it's like it's less than 1 in 100 who have come to me with any complaints or with weird labs, and we had to stop their Mavroc. It's very well tolerated, and it works great for getting rid of the symptoms of long COVID. But whether or not it has long-term effects, I mean, it's just not known. Um, let's see the fasting protocol name. So I did come up. Yeah, Don Bunker. I'm on Plavix and a baby aspirin due to a heart attack in December. Can I still take ivermectin safely? Yeah, ivermectin has no effect. It's not a blood thinner, and it doesn't have any effect on aspirin or Plavix levels. I got the Vascepa prescription. What is actually helping with it in long haul? My triglycerides have been below 100 forever, but my LDL-HDL ratios keep getting worse. Vascepa is basically like a prescription strength version of omega-3 fatty acids. They have an anti-inflammatory effect, and they in the vasculature. So that's probably the primary reason that they help. And most people should check their omega-6 to 3 ratio. Most people have too much omega-6 in their body and not enough omega-3. So that helps with that if your ratio is out of whack. But it also specifically has an anti-inflammatory effect. And there's vascular inflammation is quite common with long COVID. So that's the reason that it's used. Why has Plavix recently been added to long hauler treatment protocol? So Plavix, we started using that. First, IncelDX started recommending it, and I started using it because they were recommending it for some people who weren't responding to aspirin. And one of the tests that IncelDX runs is a vascular inflammation test. I think it's the SCD40L that they're tracking, and that test is a marker of vascular inflammation. Aspirin sometimes lowers that, and if it doesn't, then they switch to Plavix, and that's basically I followed them in that. And sometimes I switch to Plavix. I have seen some people nothing else works, and then I try adding aspirin, Plavix, and even Eliquis, which is another blood thinner, and then that makes them feel better. And so it's having they're blood thinners. So if somebody's having persistent microvascular inflammation or persistent clotting, and you can't get control of it with just aspirin, then you can either add Plavix or switch aspirin to Plavix. What are the thoughts on using emu oil for omega-3 benefits instead of fish oil? Yeah, um, I, I I love emu oil. Personally, I try to get halal stuff, and I've had trouble finding halal emu oil. Otherwise, I would probably buy it. Um, Fish oil, it's hard to get really good quality fish oil. So the best quality one that I know of is Rosita, um, Rosita rat fish oil and Rosita cod liver oil. So you can find that you can look up Rosita Rosita online. They have a website and you can buy that. That's the highest quality fish oil available. Um, Otherwise, a lot of fish oils are, rancid or bad or, just low quality and maybe more harmful than beneficial. So, but Rosita is very well made. You can look up their website. Yeah, emu oil. Yeah, fish oil versus Vascepa. So Vascepa it's like basically high dose fish oil. I don't think that there's any reason to specifically get Vascepa unless you don't tolerate the high dose fish oil. So if you can take 2 grams twice a day of omega-3 fatty acids, and it's not just fish oil, it's omega-3 fatty acids. So you want to get DHA, EPA in 2 grams of DHA and EPA, and that's kind of hard to get from a fish oil. Unless you take a lot of it. So you can find some over-the-counter versions that are concentrated EPA DHA. 2 grams twice a day of EPA DHA is essentially the same as Vascepa. Yeah, if I can find a halal emu oil, I will definitely try that. Is extended fasting effective? Yeah, I think so. Fasting works similarly to a lot of different things that we use for long COVID. So ivermectin and a lot of these other medications have similar effects as fasting does, to get rid of junk proteins from the body, basically. And so I do think that it would eventually help your body get rid of the S1 subunit of the spike protein. And people who followed up with Tom Bunker, a lot of them have also said the same thing, that they get 85 90% better with fasting. But I think there is, if you wait long enough, if you do it long enough, that final, 10-15% of benefit may take a lot longer than the first 85%. But once you get 85% better, you're a whole lot more comfortable, and you can put up with that, minor, what's left. But that might take another, people get 85% better usually within 1 to 3 months if they do what they need to do. And then the final, 10-15%, it might take another 12 months, it might take another 18 months, beyond that. But that's just like the nature of the beast. Unfortunately, for some people, it can take 1 or 2 years to get 100% better. So I had the same experience with long COVID. 85% better after a few months, and then, but I wasn't 100% better for maybe a year and a half. So this people need to realize they need to be patient. All right, thank you so much, everyone, for joining. I got to run and do this again soon. Thank you.